Before we discuss what you'll be palpating, let's talk about a few tips for good palpation. Many patients are sort of resistant to abdominal palpation, whether it's because it hurts a little bit or because they're ticklish. So one of the first things you can do to help is have your patient bend their knees up a little bit. This helps relax their abdominal muscles so that you can get the maximum palpation with the least pain. Also, keep your hand parallel to the abdomen instead of pointing down into it. Again, that's going to help decrease pain. It keeps your fingers from being quite so pointy. You can also try to distract your patient, whether just carrying on a normal conversation with them or using some guided imagery to help them relax. And lastly, if you have a ticklish patient, then what you can do is take their hand and hold it inside yours. Essentially, you'll be palpating together, but your fingertips will extend just a little bit beyond their fingertips, so you can still feel what's going on, but they perceive that their own hand is touching their abdomen, which isn't ticklish to anyone. You'll then proceed to palpate first lightly, to feel for any surface structures or masses, and then you'll move to deep palpation to try to assess actual internal organs. Let's discuss some of these structures in more detail. One of the first things you'll palpate for is the liver. Here in the right upper quadrant, the best way to feel the liver is to press your fingers in under this costal margin and then ask them to take a big deep breath. That large breath pushes the diaphragm down, pushing the liver down into your fingertips. So you'll be holding your fingers still, and then you should be able to feel the liver sort of bumping into your fingertips as they take that big deep breath. If you can't feel it pushing from the front, you can also sort of walk up by their head and hook your fingers around under the ribs and see if you can feel it that way. While you're there, maybe just a little bit lower, you can try palpating for an enlarged gallbladder in this region. Also, if it's particularly tender in that region, that's a good indication the gallbladder might be at fault. You can also try moving over to the left costal margin to feel for a spleen. You usually cannot feel the spleen, and if you do palpate an enlarged spleen, you actually want to stop palpating because an enlarged spleen is also a fragile spleen, and you don't want to cause any damage or bleeding in that area. From there, you can move midline and feel for an aortic pulse. Remember that if you feel any bulging in that pulse, we're concerned about an aneurysm. And then to each side of that, you can feel for the kidneys. Again, the kidneys are very difficult to feel, and you might only feel them in a very slender patient. But we attempt to feel them in case there's any sort of enlargement or tumor present. The entire time you're palpating the abdomen, you'll be feeling for any kind of mass or bulge. If you do feel one, you need to describe it, including the location, the size, the shape. Is it smooth or is it nodular? Is it hard or is it soft? Is it tender? Is it painful? But we also know that there are many things that can feel like masses that are actually normal findings. So this diagram helps us distinguish. Remember, you have two kidneys, so if you're feeling two identical masses to the right and the left of the aorta, then those are the kidneys you're feeling. When you're down more in the colon area, if your patient has stool in that large intestine, then it's very easy to feel that as a mass. Again, that's a perfectly normal finding. Finally, again, if you have a particularly slender patient, you may actually be able to feel some of the spinal bones, part of the pelvis back here, but that is not common in the more obese patients. If your patient is pregnant or has a full bladder, you may be able to feel those as smooth, round masses, pretty soft, near that pubic bone. If your patient has a full bladder and intact sensation, they should be able to tell you that it's uncomfortable to have you pushing on the full bladder. If your patient has any kind of spinal injury, however, they won't perceive that discomfort and may not be able to urinate, so it may be very important to be able to assess for that distended bladder. We also have some specialized tests we can use if we suspect a specific problem in our patient. The first is called inspiratory arrest. The other name you might see for it is the Murphy sign. This occurs when we're feeling for the liver. We have our fingers there waiting to feel the liver bump up against us as the patient takes a deep breath, but it's so painful when the patient feels their liver compressed that they stop breathing in. So that's what arrest means here, stop. We ask them to take a deep breath, but it's too painful and they stop, a sign of liver inflammation. If we suspect our patient has appendicitis, we may find rebound tenderness, which is also known as the Bloomberg sign. We'll find this in the right lower quadrant of the abdomen, where the appendix is. If we press in on the abdomen, it's tender. The patient will complain that it hurts. But if you suddenly release that pressure on the abdomen, that's when the pain is most severe. That's rebound tenderness. Also with appendicitis, we can assess for that pain specifically at McBurney's point. This is where we would also use that rebound tenderness test. So here's an image of where we find McBurney's point. Between the umbilicus and the anterior superior iliac spine, you create a straight line, and then about 2/3 of the way down that line, there's McBurney's point. Now, just to clarify, this diagram looks a little bit like they're labeling the pelvic bone, but we're actually just going for the soft tissue structures on top of that pelvic bone. And that's where appendicitis pain will be most painful. Of course, it's officially up to the surgeon to decide whether or not the patient has appendicitis, and they may use other information too, such as a white blood cell count or even imaging of the appendix. So that wraps it up for palpation of the abdomen. We'll now move on to just a few considerations for specialized populations.